There are credible reports that patient information have been leaked and have gone up online. How much of that are you aware of? What, if anything, can we do about that?
So on the face of it, as has been reported, data from the HSE does appear to have been displayed on the darknet. The details of that are not something that would be confirmed because it's an ongoing Garda investigation. And I must say, very grateful to the media outlets, including the online platforms, not to carry or publish any records of this nature. However, it is the case that there is a risk that patients' data will be abused. And what I can say, Shane, is that anyone who is affected by this, anyone who is approached in this manner, should contact the Gardaí in confidence. Now, you can go into any Garda station if you want, or obviously the Garda confidential line, which is 1-800-666-111.
Okay. Cormac McQuinn reporting in the Irish Times today that warnings were made 3 years ago to the HSE about weaknesses in their computer system. Issues were identified, security and controls and disaster recovery protocols flagged in internal audits. Were they acted upon? Were those warnings acted upon, or were you asleep at the wheel for the last 3 years?
The HSE has confirmed that a significant programme of work was put in place on the back of those warnings, and certainly you would expect in a system the size of the HSE that ongoing warnings about cybersecurity, about IT safety would be a constant feature of those audits, and indeed they were. And certainly I can tell you that the increase in investment in ICT is very, very significant. So in 2019 it was 130 million. Last year it went to 145, and this year we've had a very, very big increase. We've increased it to 203 million. And importantly, as part of that, we've sanctioned the IT staff in the HSE to be nearly doubled from a base of around 400.
Have you asked the Paul Reid, did we do enough? Were we well enough protected? And were you happy with the answer that you got?
Yeah, but Paul Reid and I are talking several times a day on this. Now, at the moment, as you can imagine, the focus for Paul and myself is on patients, is on making sure that we get the systems up as quickly as possible. We get the highest priority systems up, and we do it in a secure manner. But I can tell you absolutely that cybersecurity and ICT is something that the HSE takes very seriously. It's something that this government takes seriously. I take seriously, as you'll see reflected in the very significant increase in ICT.
Did we take it seriously enough, though? I'm just thinking if a country was invaded, there would be serious questions asked about the defence that was put in place. It's the same with our most sensitive data. A lot of people will be saying, did we do enough?
And they are absolutely fair and the right questions to ask, and those questions must be asked and they must be answered very comprehensively. There are hundreds of people right now working across the system, our own people, obviously, within government, within health, the HSE, the National Cyber Security Centre, and Garda Síochána, and indeed with experts from the private sector as well. A very detailed report will be compiled as to exactly what happened, how this happened, and of course one of the questions that will be asked is was enough done? I think it is important to say, though, that the HSE has come under many attacks. Healthcare systems, unfortunately, really disgustingly, healthcare systems right around the world have been targeted by these criminal gangs, and the level of global attacks is going up. But I want to reiterate that the HSE has done and does take cybersecurity and patient information absolutely deadly seriously.
Just finally on this, Minister, we spoke with a security expert, a cybersecurity expert earlier on. He seemed to think that the state could be exposed to hundreds of millions in legal claims from those who have sensitive data published online. Is that a concern? Is that something that we can protect ourselves against, or are we vulnerable to that?
Well, there are serious GDP laws in place, which obviously we comply with. I think it has been a little distasteful. I have seen some legal firms already advertising, potentially licking their lips at the
Really?
thought of being able to sue the state.
Really?
Yeah, we saw the same with the vaccine. Yeah, I saw the same with the vaccine program. We had online materials being published by law firms talking about, future law cases that patients would be able to take against the state. I find it very distasteful, I have to say. We have been attacked as a nation. Our patients in HSE have been attacked.
Should they be allowed to advertise like that, Minister?
Well, presumably it's legal, Shane. And if there are cases that can be taken, then people have a right to take those cases. But certainly, I find when we are in the middle of trying to get urgent healthcare services back up and running for sick patients, I certainly find it very distasteful that any law firm would be putting stuff up on their websites to that end. I find it equally distasteful, mind you, that some of them have done the same on the vaccine program as well. But unfortunately, it does seem to be a facet of at least a small part of the country that we live in.
And in relation to our exposure, is it too early to say potentially our legal exposure, leaving aside the pretty shameful action of some in the legal profession?
It is too early to say. Yeah, it is too early to say. Obviously, there's a huge amount of work going on by the Garda Cybercrime Bureau. They're working with the National Cybercrime Centre and international partners. What they're trying to do is identify such material, verify it, and then take any and all measures necessary to limit the exposure of the personal data online, because this will be very upsetting for people.
Okay.
It is possible that people will be targeted, but right now, as I'm sure your listeners will understand, our all efforts right now are bent towards getting services back up online for men, women and children who need them.